Welcome to this video. Here we will talk about the continuum of care and the 4 delays model. At the end of this video, you will be able to share at least 2 potential contributions you can make as a MCH volunteer.
There is an inextricable link between the health of mothers and newborns. In developing countries, the mother's death in childbirth means that her newborn will almost certainly die, and that her older children are more likely to suffer from disease. When the mother is malnourished, ill, or receives inadequate care, her newborn faces a high risk of disease and premature death. For example, almost 1/4 of newborns in developing countries are born with low birth weight, largely due to their mother's poor health and nutritional status. Low birth weight increases newborn vulnerability to infections and risk of developmental problems. The continuum of care is a core principle, framework, and foundation of programs addressing maternal, newborn, and child health. It is based on the concept that the health and well-being of women, newborns, and children are inextricably linked. It shows continuity of care in 2 dimensions, time and place. Time across the life cycle, adolescence and before pregnancy, during pregnancy, during birth, during postnatal period or days immediately after childbirth, infancy, or from 28 days to 1 year of life, and childhood, or from 1 year to 5 years of life. Place refers to the linkages between care providers, levels of care in the health system, and programs or services that operate between these levels. One example is a community health worker who refers a pregnant women with danger signs to a hospital. Actions and services across the continuum of care, it means across time and place, together contribute to the reduction of maternal, newborn, and child mortality, and injuries, infections, and disability. The 3 delays model is promoted in most countries, but in Guatemala, we have the 4 delays model. First, recognizing danger signs. Second, deciding to seek care. Third, reaching appropriate care. And 4, receiving appropriate treatment upon reaching care. In Guatemala, the first delay is basically split into 2 parts. It is assumed in the 3 delays model that if someone recognizes a danger sign, they will immediately seek care. This is not the case in Guatemala. In some cases, there are many delays in deciding to seek care after a danger sign is recognized. In many cases, women have to consult with their mother-in-law, it means suegra, first, or their husband, esposo, or the midwife, comadrona, or the religious leader, before reaching appropriate care. The good news is that most maternal and newborn deaths are preventable by ensuring that mothers and newborns have access to low-cost, life-saving interventions, and through the promotion of healthy practices through group education and counseling sessions.